Aging. I'm Ashraf Badawi. I'm the Vice President of the European Society for Lasers and Energy-Based Devices and Clinical Consultant for Clarion Medical. Today we are going to discuss the structure and function of the skin, skin types, acne and acne scars as a common problem we are facing, motivation for rejuvenation procedures and skin aging, and finally objectives of rejuvenation. It's very important to realize that skin is the largest body organ and it has multiple functions. It has immunological functions. The immune system is in the skin is recognize any foreign protein for the body, and it has very important immunological functions. It has metabolic functions. Certain elements, vitamins are going to be sensitized in the skin. It has secretory functions. We know that it has many glands which are secreting the sebum, for example. It has thermoregulatory function. We know that our body temperature is 37 degrees Celsius. Whether the temperature outside the body is 40 Celsius or minus 40, our body temperature remains the same, and this is the function of the skin to regulate the temperature of the body. It has receptory functions. Many receptors of the nervous systems are on the skin, whether receptors for pain or sensation or any other thing. And this is very important for multiple tasks our body should perform. When we start to lose the sensation, this is very dangerous. Diabetic patients who are having neuropathy, where they don't feel, they can get damage to their fingers or toes without feeling, and this might complicate the situation. Also, the skin is having excretory functions. We know that it has sweat glands which are excreting sweat. So our body is getting rid of some of the harmful elements, some salts, and this is very important for the body. Finally, it has protective function. We know that our skin is the first layer of defense. It protects our body from any environmental damage, and epidermal barrier function is one of the very important functions of the skin. So we can see that our skin is having multiple functions, and this makes the skin one of the important organs of the body. When patients of burn are having damage for most of the skin, they die due to failure of the skin and due to failure of the functions of the skin, and that's why we have to keep a good care of the skin. It's important to know that our skin is composed of different layers. We have the epidermis, and the epidermis is composed of stratum corneum and living cell layer. The dermis, which is having the collagen, and it has multiple structures like the sebaceous glands, like the hair follicles, and also we have the subcutaneous fat and tissue, and finally we have the fascia and the muscles, subcutaneous or below the skin. So all those are different layers of the skin which might have some changes in the structure and the function with aging, and we need to revert the structure back to the normal as much as we can during the process of rejuvenation. When it comes to the hair follicle structure, we can see that the hair follicle is having the hair shaft, we have the epidermis, we have the stem cells, and we have finally the hair matrix. The hair matrix is the factory of hair follicle cells and shafts. The hair matrix has the highest melanin concentration. And then we have the stem cells, which are responsible for the hair growth cycle, and they don't contain pigment, and that's why we have to target the melanin in the hair follicle. And we have also the epidermis, which is very important to be intact and healthy so that the pilosebaceous apparatus is functioning well. We have the sebaceous glands, which are secreting sebum, which are supposed to go out from the pores of the skin. And finally, we have the hair shaft, which is bulging above the surface of the skin. So we see the structure of the hair follicle. For the skin to be healthy, there are certain elements which ensure that the skin is healthy, like the smoothness of the skin is coming from normal keratinization. The healthy skin is firm, which requires abundant normal functioning collagen and elastin. The healthy skin is evenly colored, which requires properly functioning melanocytes. It is free of medical diseases, and it's free of environmentally induced deterioration. So those are the characteristics of healthy skin, and a common problem I have seen is that a person coming with a pigmentary issue, we focus on this problem, we focus on the pigmentation, whereas we don't pay attention to the other elements, to the other problems, and this is limiting the success. For example, if someone is having melasma, we know that melasma is not having a cure. And if we focus our attention and efforts on treating melasma, we will fail. However, if we are working on the other characteristics of the normal skin, if we work on the normal keratinization and try to restore it, if we stimulate the collagen so that we're regaining the firmness of the skin, besides whatever we do for pigments, then the patient is going to be happy and the patient will feel that their skin improved significantly. So this is a concept which we need to acquire, a concept which we need to implement in our daily practice, and trying to restore all the structure of the skin back to normal, or as much as we can close to the normal. Skin type is another important thing which we have to pay attention to with different energy-based device treatments. And we know that the skin is classified according to FITZPATRICK skin types from 1 to 6. 1 is the lightest skin color and 6 is the darkest. And usually we categorize the skin by the color of the skin, by the color of the hair, color of the eye, but also to the response to the ultraviolet and the sun. So for example, skin type 1, they never tan, they always burn. Skin type 6, they never burn and always tan. And in between, we can see different reaction to the ultraviolet. Is FITZPATRICK skin type classification the only one? No, we are supposed to be using also the ethnic classification of the skin, because the genetic origin of the patients will also have a very important role to play when it comes to the reaction of different stimulation of the skin, like lasers or energy-based devices or chemical peels and so on. Sometimes patients of the same FITZPATRICK classification might react differently to different stimulations, and that's why the ethnic origin is very important to be kept in mind while we discuss with the patients what to expect and how to deal with them with the different modalities of treatment. The difference between the dark skin and the fair skin is that the fair skin is not very well equipped to be exposed to the sun excessively. Usually patients with dark skin are those who are living in areas where it is sunny most of the time, and the dark skin is much more protected against the damage from the ultraviolet than the fair skin. If fair skin individuals move and live in areas where they are exposed to the sun much more than expected, sun protection becomes a very important part of their daily life. Otherwise, they are going to be exposed to a higher incidence of skin cancers, or they will get premature aging, because the ultraviolet will damage their collagen and will cause elastosis. So this is very important. On the other hand, when it comes to the melanin content, melanosomes are having the same number, whether it's dark skin or fair skin. The difference is not in the number, the difference is in the size. So melanosomes in dark skin are much larger structures than in fair or white skin. And that's why when we are working with lasers, it's very important to be cautious, conservative when we are treating people with dark skin, because the melanosomes and the melanin particles are larger and they are going to absorb the laser much more, so we can damage the skin. Whereas in fair skin, it is a bit safer when we are working for hair removal, for example. The role of melanin is the absorption and scattering of energy from ultraviolet and visible light to protect the epidermal cells from ultraviolet damage, so it will prevent or delay the actinic injury and photoaging. So the functions are photoprotection and prevention of photoaging, which is one of the primary cosmetic issues in lighter skin types 1 to 3. In 1979, Keith Bay and his group from the United States found that an average 55% of ultraviolet A rays penetrate Caucasian skin, while fewer than 18% get through African American skin, and this is why photoaging is delayed in people with dark skin. On the other hand, the melanin is responsible for hyper or hypopigmentation, because inflammation or injury to the skin is almost always accompanied by alteration in the pigmentation. So the people with dark skin will have more pigmentary disorders, hypo and hyperpigmentation. People with fair skin will have more premature aging of the skin. Some of the common causes of skin disorders is abnormalities in the pilosebaceous units, like acne, dysfunction of melanocytes, keratinocytes unit, and this might lead to different pigmentary issues. The aging, whether it is intrinsic or chronoaging, or extrinsic or photoaging, and also alteration of the barrier function, which happens with aging or with wrong use of skincare products and topical preparations. Acne vulgaris is a very common problem. It occurs in 80% in people aged 11 to 30 years, but also it can occur in adult phase. So we can have 5% of adults having adult acne. The pathogenesis of acne is very important to be understood, because this is how we can treat it when we understand the pathogenesis. So we get increase in the sebum production. We have follicular hypercornification or hyperkeratosis, and in this case the pores are going to be clogged. So increased sebum production, but it cannot go out, so it will create a medium which is going to stimulate colonization of the Propionibacterium acne, the bacteria causing the acne, which is anaerobic bacteria, and when it finds its medium, it will start to proliferate, and this will lead to creation of inflammatory reaction, where lymphocytic and neutrophilic inflammation will happen. So when that happens, we need to treat the different areas of pathogenesis by decreasing the sebum production, by working on the epidermis to decrease the hypercornification or the hyperkeratosis, by killing the bacteria, and by doing anti-inflammatory effect by repairing all those areas. Now, again, as a summary, how can the acne develop? As we said, increased production of the sebum plus clogging of the pores. Then this is going to create a good medium for proliferation of the bacteria. The bacteria is going to create inflammation, and the inflammation is going to lead to the acne appearance. This is how the acne develops. When it comes to the acne scars, we have to differentiate between acne scars associated with tissue formation and acne scars associated with loss or damage of the tissue. When we have increased tissue formation, it might be hypertrophic scars or keloids. There are some factors, predisposing factors like family history. Some families are more prone to have this problem. Racial grouping, darker skin types are usually associated with higher risk of hypertrophic scars, and also the severity of the inflammation and the site of inflammation might predispose to hypertrophic or keloid scarring. For example, the chest wall and certain areas of the face might be associated with higher risk of scarring. And on the other hand, we can have loss of or damage of the tissue. The treatment options might be excision, cryosurgery, fractional laser treatment, silicone sheet, or others. When it comes to loss of damage or damage of the tissue, we can have ice pick scars. We have rolling scars or box scar, which might be shallow or deep. So this is the ice pick, this is the rolling, and this is the box scar, which might be shallow or deep. The determining features are the width, the depth, and the three-dimensional architecture. So this is the ice pick scars, which is narrow, less than 2 millimeters, as we can see here. And it is deep, sharply marginated epithelial tract that extend vertically to the dermis or the subcutaneous tissue. The depth usually below that reached with the conventional skin resurfacing option. That's why usually the resurfacing is not the best option for this. Then we have the rolling scars, which are popular types of acne scars. They show dermal tethering, as we can see here, or relatively normal appearing skin. They are wider than the ice pick scars, 4 to 5 millimeters. They are associated with abnormal fibrous anchoring fibers, which are leading to superficial shadowing and rolling appearance. And that's why with the rolling scars, in many cases, when we try to treat, they become worse after the treatment, because we do something to stimulate the collagen synthesis, which is increasing the thickness of the skin. However, the base of the scar is dragged downwards with the anchoring fibers, and that's why the acne scar becomes deeper. And that's why it's very important when we are treating rolling scars to associate the treatment with subcision. This is very important in treating rolling scars. Regarding the boxcar scars, this is oval or rounded depressions, as we can see in this photo, with sharply demarcated vertical edges. They are wider than the ice picks. They don't taper to a point at the base, as we can see here. They can be shallow or deep. We can see here multiple scars. So we have some boxcar scars, we have ice picks scars, and we can see a few rolling scars as well in this particular patient. So this is different types of scars in the same patient. We have different treatment approaches, by topical, like chemical peeling or microdermabrasion, non-surgical with dermal fillers, using autologous collagen and fat transplantation. We can have also the PRP or subcision and laser. And we have also the surgical modes like punch, excision, grafts, and dermabrasion. So all those are different modalities. Sometimes you need to combine some of them, and sometimes one modality is going to be enough. This will depend on the patient situation, and this will depend on the clinical evaluation of the case. When it comes to the aesthetic procedures, what are the motivations for aesthetic procedures? Actually, the main motivation is the signs of aging. So if someone is looking like this today, within 30 years, she might be looking like this. So this is the main motivation. The signs of aging, like sun and age spots, poikiloderma, rosacea, large pores, fine lines, skin laxity, wrinkles, uneven skin texture and tone, roughness, loss of glow, or loss of volume. So those signs of aging are motivating people to work on those signs which occurred already, to correct them and revert them back to normal, or as close as possible to the normal. Or today we can even prevent the signs of aging or delay the signs of aging by procedures we can perform. This is a photo of someone who is having different signs of aging, like sun damage, like some deep wrinkles, like skin laxity in different areas of the skin, poikiloderma, and all those signs need to be corrected in order to give the skin more younger appearance. The different problems can occur at different age of the patient. So we can see acne scars starting from the 20s, and then we can have the sunspots and lentigines, especially in fair skin individuals, starting from also the 20s and 30s. Then after the 30s, we get patients complaining of rosacea, poikiloderma, large pores and fine lines, and then we get skin laxity, nasolabial folds, and sun damage, senile lentigines in older age. How do we get wrinkles? Over time, collagen and elastin are lost, so the skin gets thinner and has tough time getting enough moisture to the epidermis. At about the same time, the fat in the subcutaneous layer, which gives skin a plump, firm appearance, also begins to disappear. The epidermis begins to sag and wrinkles will form. So when we have wrinkles, it's important to know that this is a multifactorial thing. We lose the collagen and elastin. We have a problem with the epidermis. It's not able to hold in the moisture. When we have dryness of the skin, we have impaired elasticity. When we lose the collagen in the subcutaneous fat, while we have lost collagen, then we have skin laxity, and then we get wrinkles. So it's very important to work on all those factors to correct the problem. Otherwise, the patient will not be happy, and just filling a gap is not going to solve the problem and will not make the skin looking and functioning as healthy. When we come to the aging process of the skin, it's important to know that biologically there are two major changes happening in the skin, in the body when we age: reduction in the basic substance of the connective tissue. And when that happens, we get shorter when we age, because our bone is connective tissue, and with aging we get reduction in the basic substance of the connective tissue. And then the other change is the diminished rate of cell proliferation. So the cell proliferation rate is becoming slower, and that's why in old age healing of wounds is becoming much slower than in young age. When it comes to the skin, which is a body organ, we have two types of aging for the skin, something called chronoaging or intrinsic aging, and this is the biological aging. But because the skin is the only organ which is exposed to the environment, so it has also another type of aging which is called photoaging or extrinsic aging. If we look at the changes happening to both the epidermis and dermis with those two types of aging, we are going to see that with the chronoaging, which is the biological aging, with reduction in the basic substance of the connective tissue, we are going to see that there is collagen synthesis reduction and loss of elastic fibers. Those are the connective tissue present in the dermis. And because of the diminished rate of cell proliferation, the dermis is becoming thinner, and also the epidermis is going to have fewer cells and thinner skin. So with this chronoaging, we have delicate, thin, atrophic skin, and the main objective of dealing with chronoaging is collagen stimulation, because this is the primary defect, the primary problem. Whereas photoaging, which is extrinsic aging, is due to factors from outside the body. When the skin is exposed to factors which are injuring the skin, then the skin is trying to defend itself by becoming thicker. So we have thicker stratum corneum, and this will lead to hyperkeratosis. The dermis is becoming thicker with stretched blood vessels and inflammatory infiltrate. So in this case, we need to work on the hyperkeratosis and correct it, because it will have a negative effect and impact on the skin. So as a summary, photoaging is due to exogenous factors like ultraviolet light, cold, heat, wind, environmental pollution. This will lead to thicker stratum corneum, stretched blood vessels, thicker dermis, and hyperpigmentation. And this will end up by thickening of the skin and hyperkeratosis. Chronoaging is due to endogenous factors, and that's why it's called intrinsic aging, due to free radicals, nutrition, alcohol consumption, smoking, negative stress, sleeping disorders, lack of physical activity, and lack of estrogen, which are going to accelerate the skin aging and change in the structure. And this will lead to reduced collagen synthesis, fewer and thinner cells, loss of elastic fibers, and this will lead to thinner skin through slower cell division. This is a patient who is having accelerated skin aging, elastosis, due to severe exposure to the sun without any protection. So this is called the farmer's skin, where she's exposed to the sunlight from the sunrise till the sunset without any protection, and this will accelerate damaging the collagen and showing those. On the other hand, this is the normal pattern of aging, where we can see areas of the skin, like in the face, where we have photoaging, deep wrinkles, hyperkeratosis, roughness of the skin due to the photoaging, photo damage, whereas the neck is more protected from the sun exposure by the shadow. So we can see that it is more of chronoaging, and the skin is delicate, thin, atrophic. So in this case, we need to do procedures for both tackling the photoaging and chronoaging. This is another patient who is having photo damage, and we can see the areas of her body which are more exposed to the ultraviolet are having more sun damage than the hidden and the protected areas of the skin. So we have more hyperpigmentation in the exposed areas than in the covered areas. And that's why sun protection becomes a very important part of the daily life of of patients, especially when they are fair. On the other hand, this is another patient who is having photo damage where the skin is becoming atrophic, and we can see the telangiectasia and the vascular abnormalities in this case, and sun protection is very important in such cases. Also, it's very important to remember that aging is associated with poor or slow microcirculation, which affects vein, arteries, and lymphatics. So enhancing the microcirculation is an important part of the rejuvenation, and that's why beauticians who understand about that will have a small vacuum devices to enhance the lymphatic drainage, and also plastic surgeons who understand that will send their patients for some lymphatic drainage and some lymphatic massage before the liposuction, to work on healthier tissue and have less downtime. Also, in the rejuvenation programs, I prefer to have systems which are stimulating the microcirculation and the lymphatic drainage so that we have an optimum outcome of the procedure. It's important to remember that the skin is composed of 3 layers: the epidermis, the dermis, and the subcutaneous fat and tissue, and we have to pay attention to the changes happening in each of those layers so that we are getting an optimum outcome. When it comes to the epidermis, it's important to realize that the epidermis is composed of 2 layers, the corneocytes and the living cell layer. The corneocytes are supposed to form 35% of the thickness of the epidermis. The living cells are composing 65%. When we have photoaging, this ratio is going to be reversed, so the corneocytes will increase. Hyperkeratosis, it will increase from 35% up to 60% on the expense of the living cells, which are going to diminish from 65% down to 40%. And in this case, when we have this structure of the epidermis, this patient is coming to complain of the skin not being viable, not looking healthy, because we have less number of living cells for the nutrition. So they are going to come and tell you, my skin is looking dull. It is not young looking because of this problem with the structure. On the other hand, they will complain that whatever they apply on the skin from skincare products, even if they're expensive, they are not very effective. And this is something which is a common complaint in this case. In addition to that, when we have overcrowding of the corneocytes, hyperkeratosis, the epidermal barrier function is disturbed, and we can see that the corneocytes are not able to overlap properly, so there is transepidermal water loss, and in this case they are going to complain of skin dryness. When the skin is dry, then we are going to see that the smoothness of the skin is lost. There are fine lines and wrinkles, there are large pores. So this is something which is very important, and this slide here shows a baby who's having gastroenteritis with vomiting and diarrhea. And when there is a condition like that, we teach the parents to perform that test, pinch the abdominal skin. If it does not retract, this is a sign of dehydration, and this child needs to go to the hospital quickly to have intravenous fluids. And this shows the impact of the skin dehydration on the skin. And this is a small test which we perform sometimes to assess the degree of dehydration of the skin, where we pinch the skin in the dorsum of the hand. If the retraction takes time to happen, then this is a sign of dehydration, and we need to take all the measures to restore the hydration of the skin. Now, when we have such a situation, it's very important to work on the skin to restore the structure of the epidermis back to normal as much as we can. So when we have a structure like this, with hyperkeratosis, we have to work on the epidermis by any keratolytic modality to decrease the percentage of corneocytes back to normal. And when we do that, this is considered by the skin as trauma, which stimulates the proliferation of the living cells so that we are able to restore the epidermal structure back to normal. And in this case, we are going to have a much better structure of the epidermis with more living cells, and this will mean that the skin is going to be looking more viable. It's going to absorb anything we apply in the skin in a much better way, and in addition to that, the epidermal barrier function is going to be restored. The skin is going to be able to hold in the moisture, which is going to affect the smoothness of the skin. So the skin is going to be looking smoother because it is well hydrated. So this is what we would like to achieve. We have different modalities in order to achieve improvement of the epidermal barrier structure, starting from the skincare products which are containing keratolytic agents. like retinol, for example, some types of chemical peeling, mechanical peeling using microdermabrasion and hydrodermabrasion in different modalities like that. Even laser peeling is one of the modalities to improve the epidermis. So all those are different modalities to improve the structure of the epidermis. In many cases, people are coming to complain of things beyond the surface of the skin, but if we look carefully to the epidermis, we'll find that the epidermis is damaged, and we have to take all the measures we can in order to restore the structure and the function of the epidermis back to normal. When it comes to the dermis is composed 75% of water, which is needed to maintain the barrier function, 20% proteins, collagen, and elastin. In chronoaging, after the age of 20, we start to lose 1 to 2% of our collagen per day. Photoaging can double this loss. So areas of the skin which are more exposed to the light are going to have more chronoaging than the areas which are protected from the sun and from the light. We can see histologically that the older skin will have lost the collagen, but in general we can see all the signs of aging starting from the epidermis with hyperkeratosis. We can see here less number of living cells, flat dermoepidermal junction, and the loss of collagen in the upper dermis. So that's why this is the layer of the skin which we need to target in order to stimulate the collagen. Here, younger skin, where we can see the normal structure of the epidermis, less hyperkeratosis, more abundant living cells, tortuous dermoepidermal junction, and we can see that the collagen is present in the upper dermis without any problem. So this is what we would like to achieve when we are doing the rejuvenation. So the concept of rejuvenation is having 5 cosmetic targets where we would like to achieve improvement of the skin condition, removal of the skin damage. We need to stimulate the cell division. We need to guarantee the skin nutrition. We need to improve the cell functions. We need to achieve protection and anti-aging. As practitioners, we can achieve number 1 and number 2. So we do a procedure to improve the skin condition, removal of the skin damage. Usually, this is going to result in stimulation of cell division. The remaining 3 cosmetic targets are the homework of the patient. So they have to understand that they need to improve their nutrition, their water intake. They have to use the appropriate skincare products in order to improve the functions of the skin and protection and anti-aging by using the appropriate skincare products and sun protection to achieve maintenance and improvement of the outcome of the procedures we perform. If they didn't do their part, then our part is not going to be guaranteed. It's not going to be long-term improvement. So this is something which has to be communicated. At the level of the epidermis, we need to change this epidermis into that one through different protocols, different procedures in order to perform improvement of the epidermal barrier function. At the level of the dermis, we have to do other procedures, but how can we improve the epidermis? By skincare products which are having keratolytic agents, by chemical peels, microdermabrasion, silk peel, Endimed FSR, which can take care of the epidermis, ablative skin resurfacing, and also the M22 IPL, which can deal with the dyschromia and vascular imperfections in the superficial layers of the skin. Then at the level of the dermis, we need to do something at the level of the upper dermis to stimulate collagen synthesis to restore the structure of the dermis back to normal or as close as possible to the normal. So what are the targets? How can we achieve that? We can use the resurface of Luminous, which is non-ablative fractional laser. We can use the Endimed Intensive, which is microneedling radio frequency. We can use the M22 NdEgg in order to deal with the telangiectasia and facial veins. And also we can use the NdEgg of Photona, which is having a FRAC3 in order to stimulate collagen synthesis through non-ablative rejuvenation. So all those are different options which can be used individually or in combination according to the status and the condition of the skin we are working on. So also we have to evaluate the skin laxity, because if there is skin laxity, then we need to do something for deep tissue heating in order to tighten the skin. Otherwise the patient will not be satisfied with the outcome. So if the patient is having skin laxity, sometimes they don't recognize that they have skin laxity. It's important to highlight that and tell them that this is something important to be taken care of during the rejuvenation process. What are the technologies we have to improve the skin laxity. We can have RF by ND-Med, or we can use the Photona Piano, which is a long pulse Nd:YAG with smooth, which is a long pulse EPIDERMIS to tighten the skin and stimulate collagen synthesis. So we have different technologies, different options to tighten the skin, but the base here is that we need deep tissue heating to tighten the skin and have secondary stimulation of collagen. So this is the options which we have. We have different options for rejuvenation in general, starting from the topical preparations, chemical peeling, dermabrasion, microdermabrasion, tissue augmentation, Botox injection, mesotherapy, skin needling, surgical procedures, tissue tightening with RF, infrared, or ultrasound, and laser rejuvenation. All those different techniques and technologies are working on different layers of the skin. It is very important to design the appropriate treatment plan for each patient so that we are able to target each layer which is having a defect or a problem, and only then we are going to have the optimum outcome. And in many cases, the combinations are required in order to achieve the best satisfaction of the patient's longer term natural looking skin, and then the patients are going to be able to delay any signs of aging or revert the signs of aging which occurred already, and patients will age gracefully. Thank you very much for your attention. I hope this was a good introduction for anatomy and physiology of the skin, common problems, and the rejuvenation options, which is going to open some doors for appropriate rejuvenation options and plans, designing plans for your patients. And if you have any questions, please let us know. Thank you very much.